Good afternoon, everybody. My name is Barry Hudson. I am the Director of Public Information for Montgomery County. I am sitting in today for our normal host, so hope I don't disappoint. Today is our regular press briefing with our County Executive, Marc Elrich, our Director of Emergency Management, Homeland Security, Dr. Earl Stoddard, and our Health Officer, Dr. Travis Gales. We'll start off today with the County Executive, but before we do that, I want to make sure that everyone who needs permission to report has already done so. If you are with the media, we'll address your questions, and please make sure that you put your name and the news organization that you represent in the chat. So without further ado, I will hand it over to the County Executive to start off with opening remarks.
So good afternoon, everybody. We're now into our second year of press conferences on COVID. I want to start just by just expressing my condolences to the families, friends of the people who were killed in another mass shooting in Georgia yesterday. Whether this turns out to be a hate crime or just the crime of another mass shooting triggered by somebody with emotional instability. It's another tragedy. It's a tragedy if it's just hate. It's certainly a tragedy of what happens when this country can't come to grips with decent gun laws. So I just express my condolences and hope that someday we wake up and are willing to do the things we need to do to make sure that we can protect people from folks who probably shouldn't have possessions of guns. So then I feel bad for the community. We are reassuring the Asian community here that we are going to protect them, that we stand with them, and that we're aware of the trauma that they've been put under since the former president decided to turn this into a racial issue. But this is Montgomery County, and we're going to protect our residents and stand with our residents. On the COVID front, yesterday our case count was 119. We've been treading from either slightly below 100 to a little bit over 100. Our test positivity rate is 2.81, and our cases per 100,000 are 10.61. We did get under 10 for a couple of days, but we've now gone back over 10 into, but still 10.61. If you look at the data that the state puts out, we track pretty well in the state, but I always remind people that pretty well is not good enough, that people are still getting sick, they're still dying. 100 cases a day is a lot of cases a day, and we're going to continue to remain vigilant and careful here. The county has vaccinated 240,000 adults in this county, 30% of our county residents with the first dose, and we've done 11.8% of our county residents with the second dose. I want to talk a little bit about mass vax, because I know you guys are going to have some questions. There's been a lot of discussions about planning for a mass vaccination site here in Montgomery County. Yesterday, when Dr. Stoddard was meeting with the county council and following his due diligence and being transparent, he was talking with the council about the process and progress we've made working with the state to stand up a mass vaccination site in Montgomery County. I recognize that later that day, the governor said no decision has been made. Whether or not any decision's been made, we continue to work with them to explore what we've got available. We have Holy Cross as a partner. We are perfectly capable of standing up this site, and we believe it's important. A little factoid, Montgomery County residents, of the 5 places where where county residents have gotten the most vaccines, 3 of them are at mass vaccination sites outside of Montgomery County. That includes Prince George's County and Baltimore City. And just looking at it that way, it's a disservice to residents of those counties It certainly raises racial equity issues because, this is, it's not easy to get to these sites. The mileage, the round trip distance to M&T Stadium from where I am right now in the executive office building is 92 miles. A round trip to Six Flags is 64 miles. The Regency Furniture Stadium is 114 miles. Whereas putting something at the Montgomery College in Germantown, it would be a 20-mile round trip from the EOB. We need a site here. It would help create space in these other counties to recognize their county residents. Some of them have not been able to vaccinate as many people as sure they had hoped they could vaccinate. Making sure the county residents can get vaccinated close to home helps make sure that everybody's able to meet their vaccine targets with their population. So we'll continue to work with the state, and we've had some really good partnerships with them on a number of issues so far, and we're hoping we eventually get this resolved. But we are ready, and we're ready to provide the supports, and we've got a hospital partner, and we just need the green light. And frankly, we need the vaccines, and that's not something the governor controls. When the vaccines are there, this is something that's going to be ultimately controlled by the federal government. This is another week for us where we don't have Johnson & Johnson doses, at least not as of yet. So, we've all been looking forward to those doses. They're not here. And the county as a whole, while our health clinics are getting 6,600 doses this week, which has been an improved number, the total number of vaccines coming to all providers in Montgomery County is actually down a bit. So we're not back to the levels we were before, which explains in part why so many of our residents are having to go to other jurisdictions to get vaccinated, because some of what we used to vaccinate people with has now been diverted into these other mass vaccination sites. We have a sense of urgency about this. Everybody wants to get back to normal. We would like to be able to tell people that they can fully open their businesses. We would like to be able to open schools and not have to worry about the spread of COVID. We just need to get the population vaccinated, and we need the help and support of the state to get there. And ultimately, at the end of the day, we need the providers to make these vaccines available. We have two current locations, Richard Montgomery High School and Quince Orchard High School, that have to relocate because of MCPS reopening. So we're working on making sure that we don't have any downtime in our vaccination efforts to replace those sites. We appreciate that President Biden's pledge to increase the supply of vaccines by May to cover all adults. It makes sense for us to find at least one site that can handle the daily flow. And I want to add on that note, I hope the governor does not open up the eligibility to get more groups at this point. We've already seen what happens when the number of vaccines is dwarfed by the number of people who are eligible for vaccines. We continue to have this really messy sign-up system where every provider has their own sign-up, and that our residents, in competing for the meager doses that are available in Montgomery County, we used to say 15,000, I can't say that anymore. So when they're competing for this supply, increasing the number of competing for this supply will not get anybody vaccinated any faster. And what it may do is make it harder to vaccinate target populations. And we are working hard to deal with the target populations. We're now vaccinating people 65 to 74. We need to be able to vaccinate frontline workers, and we need to be able to vaccinate people with pre-existing conditions. And if we can't do that, and everybody gets thrown into the same pot, that means some of the most vulnerable people will be waiting longer than they should wait, which means they're more likely to be exposed until they get vaccinated. So hopefully that they'll temper the reopening to match the availability of supply. I can imagine supply levels that would make that possible, but no one yet has demonstrated we're going to see those supply levels. So a little more patience till we get there would be a good thing. I want to also talk a little bit, about the American Rescue Plan. I want to thank the federal delegation for bringing home aid that was so much needed by our state and county, and I know by states and counties around this country. All of us were hit heavily by COVID. You know, our business communities were heavily hit. This money is going to provide relief. It's going to help with tenants on rent. It's going to help with small businesses that are struggling to survive this pandemic. It's going to help governments like ours, which spent a lot of money on COVID relief and COVID supplies. It's important for all of us, and it's helping us recover. And I just want to thank the delegation for doing that. It's going to make a big difference to people and families. And it's, to me, it's one of the most important things that's happened to us. Last thing is, it's St. Patrick's Day coming up. Please be safe. The virus is still here. As much as you're going to be tempted to go out drinking, can you hold that till next year? We really don't need people staying out late and drinking and not practicing social distancing. There are too many Montgomery County residents, and it doesn't matter what county you go into the state, that are not vaccinated. And as long as we don't have the virus under control, and as long as we have caseloads like this, this is not the moment. This is not the time to resume the celebrations. Hopefully, Memorial Day and the 4th of July, we can have different conversations. But at this moment, the best thing to do on St. Patrick's Day would be to stay home, stay safe. If you're vaccinated, apparently you can gather with a small group of other friends who've been vaccinated. So there's at least one more option that wasn't available before. But whatever you do, don't push this to a point where we're going to wind up with more cases, because that just complicates the recovery efforts here. And particularly now that we're trying to open schools, the virus comes in from outside of school, first of all. And so the more people get exposed, the more the possibilities are that this will find its way back into the schools, and none of us want that to happen. So have a good St. Patrick's Day, but have a safe Patrick's Day, and help keep other people safe while you're at it. I'll stop there and turn it over to Dr. Gales.
Good afternoon and happy Wednesday to everybody. It's always a pleasure to be with you all. Thank you for the opportunity to speak and share our updates. My updates are briefed, given that we had a pretty extensive council briefing on yesterday. The county executive has covered a lot of the important points. Three things I want to emphasize is, first, yes, he is correct. It is St. Patrick's Day. It's a time where we typically do go out and are very social in spaces such as bars and restaurants. We are asking folks to be thoughtful and mindful of your interactions on today, because what we don't want to have happen, particularly as we are having conversations about moving forward and reopening, and in some places have reopened quite significantly, we don't want to see another wave of cases tied to holiday activities comparable to what we've seen in previous holidays, such as Thanksgiving and the winter holidays from before. So please be careful, please be wise, please be smart in terms of how you choose to recognize the festivities on today. Now, with that in mind, we continue to monitor the case numbers and the trends to kind of give us some direction in terms of where we need to go and how we need to proceed. We are continuing to get information from the state regarding variant cases and hope to have more comprehensive report later today or sometime tomorrow to get a continued sense of the scope and impact of the variants on our jurisdiction and the rest of the state. Now, as the county executive mentioned, we have seen the state numbers move a little bit. For example, last week when the governor had his press conference on Tuesday, the state reported just over 600 cases on that day. Over the weekend, we did have a number of days where the case count was over 1,000, and this morning that number was in the upper 900s. So we want to be mindful of that, and as the county executive mentioned, on a local level, our test positivity is holding steady, given that we continue to test at a higher clip than the state on average. But the case numbers have gone up slightly. And so we want to, as always, continue to monitor the trends to help advise us in terms of what actions we need to take next. Now, the last thing I would say is related to, and I'm sure that the case numbers get to influence the guidance in terms of how we make recommendations for businesses, sports, athletics, and a number of other things. And I do want to clarify, and I'm sure we're likely to get questions about it, is the guidance from public health related to sporting activities and youth sports have been guided by a number of different sources, including CDC, the Maryland Secondary Sports Association, as well as a number of others, including the American Academy of Pediatrics. Now, even though some of those bodies have taken out risk assessment categories as recently as this weekend, we continue to be concerned about the risks that are associated with those sports. So simply removing a label does not remove the risk factors that put certain sports at a higher risk of transmission. And we have empirical evidence in looking at other jurisdictions across the state, including Howard County, who have opened up those activities, and there have been some significant quarantines secondary to exposures in those activities. And most recently, a case involving cheerleading in Loudoun County, I believe, that was reported yesterday. So we will continue to provide advice and guidance on how to make those activities safe and to make sure that there is fair and equitable distribution of those activities that are allowed, and not just certain sports, but opening up to be able to be fair and equitable, but making sure that the public health guidance is followed to mitigate transmission as much as possible. The last thing I would highlight is related to vaccines. It's interesting how topics move and how vaccines were the topic du jour the last several weeks, and less so today. But we exhausted all of our first doses that the state allotted to us last week. We are thankful for the increase in weekly allotment of doses for the next several weeks from the state, but we do continue to encourage that our partners in hospitals and other places also continue to see an increase in doses, because that means there's more doses available for all of our county residents throughout a diverse set of options. So, and we continue to add clinics and different venues and opportunities for our residents, because we want to make sure that of the doses we receive, we do get them out and get them into folks' arms so that we can get more. Thank you, and happy to answer any questions. Dr. Stoddard.
Thank you all for being back. A few comments on mass vaccination site, just to add on to what the county executive said. We're extremely appreciative of the support that we've gotten from the state agencies thus far. We continue to work with the Maryland Department of Health. We had a meeting with them earlier today, where they today and yesterday, where they've made offers to have get us stood up on the Salesforce platform that they're utilizing for scheduling at the larger mass vaccination sites across the state, on how they can support extending the Wi-Fi and other IT infrastructure that exists at the Montgomery College Germantown campus, and how we can generally collaborate on getting this site prepared to operate when vaccine becomes available. So I know that there was some, comments from the governor. We absolutely, I've no disagreement with the governor necessarily at all, but I just want to make clear that we're getting great support from the state agencies across the board, working with the Maryland National Guard and Maryland Department of Health on laying out, designing, planning for, building out, and acquiring the infrastructure necessary to operate a site at Montgomery College in Germantown. So that's all I have for today, and look forward to your questions.
Okay, and as normal, our first question is from Chris Gordon.
Thank you very much, Barry. And as you may know, this probably will be the last week I have the first question. I've enjoyed working with all of you over many years. You're all honorable public servants. Having said that, my question is, as far as the mass vaccination center at Montgomery County, Germantown, Dr. Stoddard, you just seem to indicate that that's still being worked on, still a possibility. So if you can clarify what happened and what's likely to, more than that, what's likely to happen if, as I understand it, you will lose Richard Montgomery and Quince Orchard as sites soon. So what do you do? Where do you go? And is there a possibility for a mass vaccination site?
Yes, so as we described yesterday to the county council, the relationship that we're looking at the Montgomery College Germantown campus is very different from what the other mass vaccination sites have been across the state. Namely, the state is more looking for partnerships to have with local jurisdictions and health providers to develop sites that the local partners sort of operate that are state supported as opposed to state owned and operated. And so we tried to be clear about that yesterday, and that still remains the case. And so in furtherance of that, I don't think that this is Montgomery College Germantown campus operation is, it's going to happen. It's just a matter of how the state views the partnership. In the immediate term, we as the county will be moving operations to that site over the coming weeks. And obviously, in order to expand it out to be what one might call a mass vaccination site, which frankly is not a term that has any sort of real limits on it, we're looking to build a FEMA Type 2 site at the college, which means we have to have the expandable capability of not just offering vaccine there, but also offering a quantity of vaccine with traffic and all those other logistics worked out. And that's really where the state partnership comes in, is they've got the experience and know-how of operating these larger sites across the state, and they can bring to bear a lot of resources, but also technical expertise on how to effectively do that. So we can start operating the site as a county at a much lower capacity and build up as the state becomes more comfortable saying as such to what others might call a mass vaccination site.
Okay, but if I can say, the governor in Charles County last week says that both Charles County and Six Flags should be capable of 6,000 doses a day. Montgomery County Department of Health gets something in the range of 4,600 a week. So what you're trying to do is use that as a vaccination, calling it a mass vaccination site, but it's kind of a mini mass vaccination site, is it not? In other words, you just don't have the doses to make that into a vaccination site without the state and the federal government giving you the doses.
As the governor alluded to yesterday, there is a significant expectation that the federal government has created that there will be substantially more vaccines available to us over the coming weeks and months, meaning that there will need to be infrastructure in place that is built so that when this surge of vaccine starts to flow down to the state, that the state and in turn the county have these vehicles available to it that are ready to go and ready to ramp up. And so the time to build vaccine capacity is not after the vaccine arrives. And I think that's what the state is recognizing in this partnership method. I know the governor alluded to the fact that they're talking to 4 or 5 counties. That is absolutely accurate. I know that when they were visiting us on Saturday, they said they had additional visits across the state to plan out sites across the state that could be possibilities as well, and that the locations that they look at in counties influence what other sites they look at in other counties, because they want to have a geographic distribution of sites. And so yes, I mean this is one of those things where I think that certainly impacts the way the governor describes this, because he does, he rightfully cannot overcommit the vaccine that he does not have. He cannot say Montgomery County or Frederick County or whomever else he wants to make agreements with, we're going to give you this amount of doses on this date, because he does not know whether he's going to have the doses available to him from the federal government to allow him to do that. So I think we understand his concern about the notion that they're going to commit to doing something that they don't have the vaccine today to do. But on the same point, he knows, and he's being told, and everything we hear is that there's this increase coming. You've got to have the infrastructure in place across the state to distribute it.
I'm going to say thank you. I know a lot of my colleagues will probably ask follow-up questions to this, so rather than impose on their time and availability. And I thank you all again. It's been a pleasure working with you over many years.
Chris, I just want to say thank you too, because you've always been really straight about things. You ask good questions. You're the press. You're persistent when you need to be persistent, and I've always enjoyed talking to you. So I wish you luck, success in what you're going to go do next, and I hope part of that includes retiring so that you can actually relax a little bit. I think this has to be a hard year for all of us, and maybe a break from this is not a bad thing.
Thank you very much, Mr. County Executive. I appreciate that. I have to learn how to relax. So for the meantime, I'm going to be practicing law, which probably most people will not find that relaxing. Thank you, sir.
All right. Moving on to our next question, we have Stephanie from Fox 5 with a question.
Thank you, Barry. Barry. Thank you, everybody. Chris, I have to call you after this news conference. I have a first follow-up question to Chris's question, but then I have a couple of questions for Dr. Gales on sporting, if that's okay. Just the follow-up to Dr. Stoddard. So at this point, when do you all foresee getting to open that site? And then also about how many vaccines do you foresee being able to administer when you first open there?
Sure. So, and this is certainly a question I think Dr. Gales may want to add to this, because obviously this is will be initially a largely HHS, Health and Human Services led operation, but obviously the agreement we have with Montgomery County Public Schools is to be out of the 2 high schools by April 1st. So we will need other locations to begin to give out large numbers of doses, and obviously the Montgomery College Germantown campus is one of those sites. So I believe the team's been out there all this week, and I don't want to commit to a specific day, but I would guess it will. I feel pretty confident saying it's going to be before April 1st that we will begin operating out of the Montgomery College Germantown campus. And at the recommendation of the state, when they visited and in subsequent meetings with us, they recommend a ramp up regardless of whether you've got the vaccines or not. So even for the mass vaccination sites across the state, they start operating around 250 doses a day, and they ramp up progressively over time, so that you can, obviously be able to, make sure that your system works logistically to do it. Right now, we're doing about 1,500 doses a day or can do at each of the respective high school sites. So I would imagine that the Montgomery College Germantown campus would probably, regardless of the sort of inclusion of additional doses from the state, be able to get up to that 1,000 to 1,500 doses a day level. I don't know if Dr. Gales wants to have additional comments on that.
Yeah, so we have been preparing for returning the spaces at MCPS schools back to MCPS, if you will. We are very thankful for our partners at MCPS for allowing us to use those venues. We have been vetting other venues throughout the community, not just the Germantown campus, but other sites as well, to continue to ensure geographic diversity in terms of access points for our residents. And as we move forward with that, we will be announcing those locations as we do on a weekly basis, where the clinics will be when individuals have an opportunity to register. So stay tuned.
And then some of the sporting questions, I know that there was a couple of things that were mentioned with regard to sports. Well, there's a protest on Sunday, right? And parents, especially the football community, want to know when they can continue. Clearly, football and contact sport is very important for them. A question to that is, have you changed since earlier in the week? Have you changed your consideration to the county council, who might take this up as early as Friday? With regard to the soccerplex, has there been any decision made with the waiver to allow spectators so that parents can watch? Those are 2 questions there, and then I follow up with one more.
So we've been clear about the guidance in terms of the concerns we have about different athletics and sporting activities. And as we stated in the council briefing yesterday, was that if the decision is to move forward on that, we will provide the guidance to ensure that those activities can be done as safely as possible, notwithstanding those concerns. So from my understanding, as council discussed in their briefing yesterday, that they would be reviewing that action on Friday. And we have worked closely with our colleagues from MCPS to discuss what parameters could be put into place to mitigate transmission as much as possible if those activities move forward. Let us be clear also that in our efforts in providing guidance, we're not trying to keep anyone from being able to enjoy activities. We're trying to keep everybody safe. And so while we do understand the passion that folks have around these issues, ultimately that's what motivates and guides the information that we put forward. It has been concerning that when we look at other jurisdictions, again, our neighbor in Howard County, who has opened up football, they have started playing, that there are at least 6 high schools that have been put on quarantine status. And so we want to make sure that in our guidance provided, that we are completely transparent and share those concerns, share the guidance in terms of mitigating protective protocols to be put into place. And one of the things that I want to emphasize that we talked about yesterday is, while we can do everything we can possibly try to mitigate transmission on the field of play, it really is up to our residents to make sure that when they step off the field of play, before they get there, that they do everything they can to stay safe and to prevent coming into contact with COVID-19 so that they're not bringing it onto the field of play and ultimately potentially bringing it into the classroom after those potential exposures. So in summary, I believe council will be taking up action on Friday. We will continue to provide guidance in order to make sure that those activities can be done as safely as possible. And as it currently stands by the order, spectators are not allowed at these different events across the board. What we are concerned about is taking steps to move forward, allowing sports to happen, to give kids the opportunity to do so, and making sure that can be done safely and that there are no concerns or potential transmission within those spaces. And then the next layer of conversation is how do you bring other people within the mix to ensure that that can be done safely and not introduce COVID into the field of play.
Then a follow-up question to that.
Stephanie, I'm gonna need to, we have a pretty hard stop today. So I'll loop back to you, but I want to get through these other questions first because we have a couple of reporters before as well. So we'll put a pin in that one and we'll come back to you. Okay. Scott Broom.
Sure. Hey, you're saying I can't burn any time worshiping at Chris Gordon's feet?
That's correct.
All right. I'll worship another time. Okay. So my question's straightforward and it's in the chat. Mr. County Executive, do you believe this vaccine distribution issue has been politicized on the state side of things? And explain, please. Otherwise, if it hasn't, what do you think explains the tension between the state and the county over distributions and mass vax and all the rest of it? Thank you.
I mean, the tension from our perspective is, let's see, we're the largest county in the state. We had the most cases. We had the most deaths. I think we're second in cases. We had the most deaths. We were the hardest hit to begin with. And the distribution of vaccine doesn't seem equitable, even if you break it down to percentages of vaccines going to different jurisdictions. So while it's great that our county residents are going to other places and getting vaccinated, the fact that I don't even have, if you were to say, what's my share of vaccines distributed to the county, the number we're getting right now does not make sense. We were getting more money, more vaccines earlier on. We're getting less vaccines now. This is at a time when the state actually had an increase in vaccines. So it doesn't make sense. And from our perspective, it's nice that some of our residents are getting vaccines at other sites. I told you the mileage, but somebody pointed out to me that an Uber ride for the person who doesn't have a car to make this journey is like $100 round trip to some of these places. So it's not accessible. I mean, whatever we're doing ought to be spread out among states so everybody can get access to it through the county. We ought to be able to get access to a mass vaccination site. It may mean that everybody's doses get pinched a little bit in the moment, but supposedly we're heading into a period when there are going to be a lot more vaccines. When that happens, then we need to be able to do the same things that every other jurisdiction is doing. And I'll go back to what I said before. From an equity perspective, it would be helpful if places like Prince George's County and Baltimore could use the vaccines they're getting to vaccinate their residents, and the county residents could get an adequate supply in our own county, that they weren't having to go to other counties to get vaccinated. What's been subtracted from us has been added to other places.
So, Mr. County Executive, I mean, does politics explain some of this? What explains it?
I mean, you could argue that they looked at our numbers and said, you guys are being more successful in vaccinating people. Other people are having a harder time, which would be a great argument, except that we're now using up the vaccines that the people who have had a harder time vaccinating their populations were intended to help. So that hasn't played out perhaps the way they thought it was going to play out. I mean, it's bothersome, but you know, we're not the only county. I've said this before. We've had differences with the governor on some of these things. Other counties have had the same differences. All of the health officers, all the county executives thought more doses should be going to the health departments. All of us felt that we had a better chance of assuring the distribution was fair and equitable. All of us would have prevented the incidents that occurred at one Walmart where the bulk of the people getting vaccinated weren't even from the state of Maryland, let alone from the county where the Walmart was located in. So we've always felt that in terms of getting people vaccinated in the state of Maryland, the health clinics are actually the state's best resource for assuring that those are the people who get the doses that have been given to us by the federal government to vaccinate our residents. We just have a disagreement. But on the other hand, we work with them on a lot of other issues. And so it's not like, you know, this is like always political, but this one, whether it's political, whether it's a serious disagreement about how this is going to play out, I won't nail it as political, but I just say this is a place we disagree.
Okay. Next question is Jordan from MCM.
Thank you. Chris Gordon, it's been great working with you and I wish you well in your future endeavors. I just wanted to know, as we all know, a lot of my questions were already answered, but Maryland recently launched a new statewide COVID vaccine pre-registration site. What does that mean for Montgomery County? I know there was a lot of confusion around that in the past. What does that mean moving forward?
So the pre-registration site that the state launched is specifically for mass vaccination sites. It's not a pre-registration system for any of the other venues that you can access through to get vaccines. And as far as it relates to Montgomery County, we've had a pre-registration system in place for several months now that we continue to utilize and we continue to leverage in order to be able to reach out to our residents and let them know when they are eligible for the vaccines and they can schedule their appointments.
So I just want to add that, you know, this is a real problem because there are so many different providers and every one of them has their own registration system. And as I've said before, you've got thousands of people getting online either when they know it opens up the night before or in the morning and trying to get these slots. There is not a reason in the world, because the technology is there, that the state couldn't stand up a single registration site. And once you're registered, give you an identifier. And every day you could go into the system and you could see all of the providers and all of the slots and pick a slot. Nobody should have to do one CVS and then another CVS and then another CVS. And then when you're done with exhausting the CVSs that ran out of vaccines, then go do the Rite Aids and then do the Giants and then do the Safeways and then wind up coming back the next day to do the same thing again. I understand that people are going to have to visit more than once until we have enough supply that everybody could actually schedule out the next month. But we don't have enough supply to really schedule out the next month, at least enough supply in relationship to our population. When the moment happens that the state's got enough supply, they need to go to a single system. So everybody just gets in and picks a slot and registers. People can deal with a scheduled appointment that's 2 weeks from now or 3 weeks from now. What people can't deal with is not being able to get registered for something they were told they could get. So it's not a hard fix. You know, there's software out there that can do it. I've had too many people tell me that if we had this program or that program, the state could have dealt with it. I know the state has actually had conversations with people who told them they could deal with it. They just need to fix it. And oh, by the way, the federal government will pay for the software. So I don't even know why we're dealing around where we are right now and not just fixing this problem.
Got it. Thank you.
I have one comment, because I think that when we think about this from what's likely to happen for Montgomery County residents, it's important to recognize that Montgomery County residents, under the free-for-all scheme that the mass vaccination sites have utilized to date, have been very successful in getting slots. And so what pre-registration will functionally mean, and again, we support the idea of pre-registration because it's a lot better for determining equity and all these other things. What's functionally likely going to happen is the names that are selected for pre-registration will probably be will not favor Montgomery County residents in the way that they've been able to make reservations to date. And so functionally what will happen is a reduction in the amount of vaccinated Montgomery County residents over time if the pre-registration system plays out the way you would expect a pre-registration to play out. So again, that lends additional credence to the notion that we need a larger site in Montgomery County to offset what's going to be lost at these other 5 sites across the state that we are no longer going to be disproportionately accessing.
Thank you very much.
Okay, just want to remind everybody, we have a pretty hard stop today at, I believe, 1:25. So want to make sure we get through all your questions. Next question is for Caitlin from Bethesda Beat.
Hi, good afternoon. Question for Dr. Gales and or Dr. Stoddard about schools. Through the first 2 weeks of face-to-face learning in MCPS, the district has reported 11 with COVID cases and 2 outbreaks. I'm wondering if that's within the bounds of what you would expect, especially noting that only 68 of the schools were open at the time that those cases were reported. And have you seen any evidence of in-school transmission? And do you know roughly how many investigations into COVID-like symptoms you have done thus far?
Caitlin, I'd have to get back with you with the more specific information related to the exact number of outbreaks. So happy to follow up with you on that. We don't have a magical number, if you will, of what we would expect to see. I mean, ideally, we would hope to not see any cases involving any investigations or quarantine. But certainly, given our experience that we had when a number of the non-public schools opened last fall, we did see cases, and we knew that this would likely happen. But there's no magical number in terms of what we would expect to see or hope to see. What I will emphasize is that, again, we work very closely with our colleagues at MCPS. They work very closely with our disease control staff to identify, to report the positive cases, and then go through and have a successful contact tracing exercise to be able to identify those who are close contacts and provide the necessary guidance in terms of the next steps and what they need to do to keep the kids and the staff safe.
In any evidence, to your knowledge, of in-school transmission between students and staff?
Currently, that's part of it. Is I don't have that information in front of me. I don't believe so, but would be happy to follow up with you after this to provide that information.
Thank you.
Next question is Kate Ryan, and she has a question for Dr. Gales and Dr. Stoddard.
Yes, thank you very much. And because it's St. Patrick's Day, my last name is Ryan. I will take the time to say, Chris Gordon, may the road rise up to meet you. Okay, so questions here for Dr. Stoddard again, and I know the mass vaccination site yet again, but I want to be crystal clear on this. You will set it up on, and the county will set it up on its own initially, but you've already got support from the state. You said you were on the phone with Maryland Department of Health officials this morning. At what point does that open, even if you don't have the added supplies, but as a standalone facility?
So as I mentioned, I think answering your earlier question, obviously our intention is to open it before April 1st, even as a, it won't be the full, we talked about April 15th, having the logistics. It's going to be like we open it and we're adding onto it as it's open. It's not going to, that's the way this is going to work. We're going to get the initial site set up before April 1st and then expand onto it with additional capacity and capability so that we can meet that April 15th timeline for when all of the partners had agreed that we wanted to be able, if the vaccine's available, to do the 3,000 doses a day. That's our goal, is to have every logistics, personnel, traffic flow, all that stuff in line for April 15th for it. If the vaccine is available, we'll be able to do 3,000 shots a day starting that day.
Do you have to pull staff from other sites in order to, or would that be simply a shift from Richard, Montgomery, and Quince Orchard?
So part of it, we would be shifting from, as Dr. Stoddard mentioned, we would be shifting our operations from some of those other sites to be able to support. And I also want to emphasize is that we are not putting all of our eggs into one basket into Germantown. We are going to stand up vaccine opportunities at multiple other sites as well to be able to increase contact points for our residents to be able to access.
Got it.
And as a reminder, we also are are partnering with Holy Cross Health, and so they will be bringing in additional staffing support, supplies, and other things to help support the site as well. So it will not be just the Department of Health and Human Services endeavor, nor will it be just a Holy Cross or a state or whatever. It is meant to be a partnership, which again, based on our conversation with the state, the partnership is defined as people bring durable commitments of resources. They have to actually bring something to the table for it to be a partnership, and that's
Got it. Last question, because I know we're short on time. Latino community, there was a town hall last night with a state delegate and Casa of Maryland's Gustavo Torres. What kind of participation are you finding among Latino residents? Do you have more, are you seeing people express more confidence in getting vaccinated and their ability to get vaccinated in the county?
From a clinical service delivery standpoint, we certainly appreciate all of those partnerships you mentioned that we've enjoyed pre-COVID as well as through the pandemic. And we continue to explore how we can leverage those resources to increase, again, access points for folks to be able to get the vaccine. As Dr. Stoddard mentioned, we are building infrastructure to be able to absorb a large windfall of doses, hopefully in the near future. And we've continued to work with a number of clinics who have significant outreach within those communities to discuss how we can partner in terms of supporting them to provide doses to folks within the community, both in the traditional clinical building, as well as looking at other opportunities such as mobile outreach and providing of services that way. There's extensive efforts utilizing the minority health initiatives and programs in those community agencies as well over the last several weeks, in particular around getting folks pre-registered and driving up those numbers, because ultimately we feel strongly if we can get more folks pre-registered, that means there's more folks in the queue that we can send links to ultimately get vaccinated, which would drive up the numbers and get them closer to a representative sample of our population distribution.
Thank you. Thank you very much.
All right, Rebecca Tan, Washington Post.
Thank you, and sorry I was a little bit late, so I'm sorry if this was already addressed. But if the state says, on April 15th or slightly before, that it no longer wants to support a mass site in Montgomery County, does it have the ability to move forward and scale that facility up on its own?
Not unless they give us the vaccines. I mean, there's no point in standing up a mass vac site. Like this week, we got 6,600 doses. I could put them out in the mass vaccine site in what, 1 or 2 days? What would be the point of doing that when I'm able to distribute? I mean, the advantage of what we're doing is we're getting these doses out all over the county, close to where people live. So I could stand up anything. I could stand up a mass vac site before April 15th if somebody would drop the doses on us. I could also get 6,000 doses out a week just with our existing infrastructure if they gave us 6,000 more doses next week. So we've got the ability to get the doses out. But if they don't give us the doses, they're not going to go out. And that's irrelevant whether they give us a mass vac site or just get us the doses. We'll get them out either way. We're just trying to help here by arranging the partnership and being able to get skin in the game so we can say we're ready to do the mass vac site.
So the thing you need, I guess the piece that you need from the state is really those vaccine doses and trying to pull off a site.
Yes, that's it. That and that alone is the difference between who we vaccinate and how fast we vaccinate them.
We benefit from their knowledge, but right, the knowledge is not a shot in the arm, right? We need if we don't have the doses available to us, their knowledge does not help us as much. And we appreciate their involvement, but at the end of the day, if there's not going to be any more doses, there's not going to be a need for a mass vaccination site because, again, it's part of a portfolio, and if we need a portfolio of things, efforts across the county, and if we can't, if it's going to mean that we operate a mass vac site and we don't have any of those other smaller community opportunities, that doesn't make sense.
Got it. And one more sort of unrelated question for county executive. I saw the statement you put out on the shooting in Atlanta, the really horrific shooting. You said that the police department is increasing patrol of certain neighborhoods. Can you talk a little bit more about what the county is doing in response to that shooting and what your concerns are here?
Well, I guess my concerns are here about everybody's concerns everywhere. There's been an uptick in hate crimes against Asians. There's been an uptick in just generally insulting, degrading behavior by people who, I guess we're influenced by Trump's decision that this was a China disease, which was just an awful thing for him to say, and it just fuels, people's fears of other people. I guess his legacy lingers on. So, we're making sure that, our officers are around communities and available. And we're also talking to the leaders of those communities to let them know that nothing's changed in Montgomery County, that we're going to stand here with them and we're going to make sure that they're safe and that we are aware of the increased pressure they're under. And we're just not going to wait for an incident to happen before we decide it's time to reach out. We're going to be reaching out now.
Do you have a
I actually
sense?
knew this
Sorry.
before anyway.
Right. Do you have a sense, County Executive Elrich, whether there's been an increase in violence against Asian residents in Montgomery County?
I know people anecdotally talk about an increase in anti-Asian behaviors, insults. I think there've been a couple of incidents, but mostly on the verbal side of things. That's bad enough. I mean, people should feel comfortable being here. Nobody should feel like that it's okay to experience degradation because somebody is intolerant. So, to the extent that we start, seeing more of that, it's not healthy for everybody in Montgomery County. Once you decide that one person is somebody you don't want to have to deal with, you can extend that to anybody. And that leads to a totally fractured society. And we need to make sure this does not continue down that path.
All right. Thank you, everyone. I want to thank you all for joining us. And Chris Gordon, on a personal note, it's been a pleasure working with you over the years. You're a real pro. I thought you were going off to be a haberdasher like your dad. But anyhow, have a good and safe week, everyone. And thank you again. We'll see you next week.